If you find the blockage that could cause a heart attack, you save a life. Cardiovascular diseases are the top number one leading cause of death globally. How doctors actually see the blood vessels that supply or feeds the heart. Let's understand this through a real-time patient case. Coronary angiography is often something patients feel anxious about, but today we will help to remove that fear. So it's our CATHLAB, and we have a patient who has coronary artery disease, which means that there is some sort of blockage in his blood vessels, and I'll be recording the whole process from start to the end, so stick with us. You will also see how a stent looks like and how it expands to open a blocked artery, restoring normal blood flow to the muscle of the heart. Before entering the cath lab, every team member changes into sterile clothing and dedicated footwear. This helps maintain a completely infection-free environment. Inside the cath lab, we wear lead aprons for protection, as the procedure involves controlled radiation exposure. These are the monitors where we observe the patient's heart vessels in real time, ECG tracing, which tells us about the heart rate of the patient, the blood pressure of the patient, and many other vitals which we keep an eye on during the procedure. Okay, so this is our scrub area where all the team members thoroughly wash and prepare their hands, nails before the procedure. And this is our control room where the team continuously monitors the patient vital signs, ECG tracings, blood pressure readings, while also guiding the procedure. There is a mic which you see, and those who are sitting in this control room basically can guide the operator through this mic. Okay, now we are inside the cath lab, the patient is being positioned and the team is getting ready to begin. Coronary angiography is usually performed through an artery in the wrist or sometimes in the leg. The patient is covered with sterile sheets, leaving only the access site exposed. First, we administer local anesthesia at the wrist to minimize the discomfort, as this is the area where the artery will be accessed, and this is typically the only slightly painful step of the procedure. We wait for some time to get the anesthesia kick in, and then a sheath is inserted into this artery. Through this sheath, we introduce catheters, balloons and stents. There is a hole inside the sheath through which we insert the remaining things if needed. Now the catheter is carefully guided through the artery up to the heart, reaching to the origin of the coronary vessels, and we carefully see this through the monitor so that the catheter reaches to the right place. Now once the catheter is in the position on the ostia from where the coronary vessels arises, we inject a contrast dye. This dye allows us to clearly visualize the coronary arteries and identifying any blockage. As you can see that this C-arm or a radiation source moves in multiple directions, so we take multiple views from different angles as the imaging machine rotates around the patient, giving us a complete assessment of the vessels. Throughout the procedure, the cardiology team discusses the findings in real time and plans the best treatment strategy based on the patient's condition. Okay, once the procedure is done, then the cardiology team, come to the control room and we again discuss the findings and explain the findings to the patient attendants, and we also tell them about the treatment strategy.